All right, looks like we're live on Facebook.
And the other platforms too.
Yes, and I will just wait for a few more people to join. How's everyone? Thank you so much for joining. This has been an exciting week. We've been learning quite a bit. It's been so interesting. So interesting. So I see a lot of people are connecting. Welcome, welcome. We'll be starting in about a minute, and I'll let everyone unmute so we can all say hello and wave at each other. And I see Marsha from yesterday. Look at her profile picture. She's our food planner. Marsha Chirisa. I know. She had a lot to share yesterday in helping mothers meal prep and make homemade meals instead of buying. Oh my gosh, do you know what she said? She said that's sadza and ribs. Who knew sadza could look like that?
Really?
Right there, Wema. I don't know if you can see. Who knew sadza could look like that? Wow. That's amazing. Mr. Msarurwa, welcome. I see you there. Bless more. Welcome. Melody, welcome again.
Thank you so much. I'll be watching from the terraces. I'll just be listening to what you are saying.
Mr. Msaruro is a panelist on Friday. He's on the fatherhood panel, and he's been attending the TUDiki shower for the past 3 years. This is the third one we've done, and he always comes with his wife. So I invited him to be a panelist just to talk about fatherhood in Zimbabwe. So definitely tune in. Hey, Venus. That's Venus Nenyasha. She's been our guest. Sorry, I'm greeting the baby first before you, my Venus. She's been our guest all week. How are you?
Say hi.
Hi, Venus. That's Venus Nenyasha. All right. Okay, so we'll get started. Welcome to day 3 of our 3rd annual TUDiki shower. I would like to thank my guests today. Today is Meet the Doctors. So on the panel, I will introduce, let me share my screen so you can all see who they are. Just give me one moment. So on the panel today, we have Dr. Zanele Dinika. She's a dentist, and she's really into pediatric dentistry. So for all you with young children, she has that magic touch. On the panel, we'll also have Dr. Anesu Tongona, and she'll be joining at 12:30, about 12:15, 12:30, because her baby goes to sleep around this time. So she wants to make sure that she's fast asleep as she's on this call. And then we have Dr. Nyarai Paweni from Sage Restorative, who's with us today. And we have our esteemed panelist, moderator, Janet Sibanda. And I would like to share a little bit more about Janet. She is a mom of 2, and she's a blogger. I can't believe that she just started this blog about 5 months ago, right as COVID hit. She started this, but it looks like it's been a page that's been there for years. It's full of resources for new moms, for parents of new moms and dads, for parents of toddlers. She has a parenting center. And if you'd like to be featured on her blog, please get in touch. All her information is on her website. She has really good information on there on anything you need to know about kids and baby. And she also has her pages, Mwanangu Mtanami. She's on Facebook and she's on Instagram. So today I'm handing over the moderating of this discussion to her, because I'm not a mom, and she is. So I thought she would be more of an expert and ask the right question. I don't want to lead you astray, so I'm leaving you in her very capable hands. And I'm just going to recap what we've had this week. On Monday, we had a panel with our moms. We called it Motherhood. That was really, really exciting. And all these moms have these new age names. You know, we have the Arikos, Arikoishe, we have the Minis, Minana, we have the Alexis. We don't have, you know, the old age names like Shingi, Shingirai, the Tatendas, the Tawandas are all gone. We have these new names. They're creative and they're fun names. So that was exciting. And, you know, they just shared some of the things that they've been going through. And one thing that's coming out the most is burnout and just fatigue, feeling overwhelmed from the new moms. Some were blaming the dads for not being fully involved. So Mr. Msarurwa, I hope you're ready for Friday to defend yourselves in fatherhood. Some of it is just really not knowing who to turn to. So the purpose of the TUDiki shower is to just bring you resources that are available in Zimbabwe. So you have a huge network of people who can support you through your pregnancy journey. If you're looking to get pregnant, I know Dr. Nyarai will share with us on, you know, trying to get yourself ready for that pregnancy journey. Yesterday we talked to Katinka. She's a lactation consultant in Harare, and if you're not in Harare, she can meet with you virtually, and she has a lot of resources on her website, local resources, services. So don't feel like you're on this journey alone. There is just so much. So that's really the main reason why we have the TUDiki shower, to empower you, to make your parenting journey easier. It's never, we're not going to say it's easy, but we're trying to lighten the burden and just make it easier. And my other good friend yesterday on the panel on feeding and nutrition was Molefia Kuona. She's a registered dietitian in Harare, and she works for the Ministry of Health and Child Welfare. And this is her website, rdinc.co.zw. And you can go on her website and get information on, you know, medical nutrition therapy, nutrition education, menu planning, food and service unit management. And I was just looking at Marsha's page. Marsha is on the Zoom. Just check out her profile picture. That's Sadza, by the way, that she has on there. And she's a meal planner, and she helps moms prepare meals in a cost-effective and time-saving way. And she just makes that eases that burnout that you feel like you've been experiencing, that you all were talking about. And again, like I said, we also have Dr. Nyarai on the panel with Sage Restorative, and she'll be, she's rooted in neuropathic philosophy, and she'll be sharing more on what she does. And she's based in Newlands in Harare, and she's at 15 York Avenue in Harare, and you can contact her. Her page is on there, and you can also visit our website, the TUDiki Shower, just to see who some of the speakers were. We had some exciting speakers, and we're halfway through. We've had some exciting speakers all through this week, and I hope you've been learning a lot. Feel free to ask us questions. We have lots of giveaways. Great sponsors, Katinka Breastfeeding. Obviously, Mwanangu Mtanami, you can be a guest on her program. Samsara, we did give away something from Samsara. She does beautiful African outfits for families. Rudo Maternity Wear, we're yet to give away something from Rudo Maternity Wear. Tapira Sweet Solution, it's a skincare range. She'll be on our beauty and wellness program tomorrow. We have Run Walk for Life. We'll also be giving that away tomorrow. Sana Hair Care for Children. It's a beauty salon for young girls in Harare. Gax Photography. Again, we have Sage Restorative Health and so many others. I know some people were throwing in gifts. Prizes to be given away. But one thing I wanted to also bring your attention to, and this is by popular demand from the moms and dads, and since this is a virtual event, people thought that it would be really good to have people also donate to a worthy cause. A lot of people have been affected by COVID. People are out of work, and even without COVID, we're going through, you know, tough economic times, and a lot of people cannot afford just the basic preparation for their newborn babies. So we are we'll be donating hampers for new moms and dads. So if you can donate to that, we have the donation information on our this is the link, but if you go on our Facebook page, you'll be able to see the donation link. And for those on Zoom, I'm going to copy it and then share with you on the page. So I'm going to hand over the reins to Janet, who will be moderating. And if you're on Facebook, keep it let's keep it interactive, and if you have any questions, feel free to ask those, and prizes are only given to those who speak up, to those who ask questions. So I don't know most of you, so there's no favoritism. If I see something that I like, we'll give you a prize. So let's get started, Janet.
Awesome. Thank you, Shingi. Hi again, everyone. So today our session is Meet the Doctors, as Shingi already said. And we're going to start off with a presentation from Dr. Danika, our dentist, and then she's just going to walk us through what moms and babies go through with their oral hygiene. So Dr. Danika, over to you. Hello, Dr. Danika, are you there?
Oh, let me see.
Okay.
Actually having a glitch with my laptop right now. Okay, can you hear me now?
Yes, can hear you. Awesome.
Okay, great. Okay, so hi everybody. So happy to be here. I spoke at the very first TUDiki shower. So I'm sorry, so I'm not able to share my screen. You can just let me share the screen.
Okay, can you try now?
Okay, let me try again. Okay. My laptop is really slowing down. So I was saying I was at the very first TUDiki shower, and it was the most amazing experience. I learned so much. I mean, I was not even an expecting mother, but I was like, wow, I learned so much. I think probably my most favorite part was the CPR. I remember you had a session on CPR, and I just thought, wow, I learned so much, and it was so amazing. Okay, I'm still waiting. Okay, let me try again.
So just hit share screen. It should be at the bottom. I allowed you to share.
Oh, it's still saying I can't share whilst another participant is sharing. Okay.
Well, maybe you can talk us through it as we figure it out.
Yeah, or you can just quickly send it to me, and I can share if you're having problems.
Okay. That's fine.
And while we're on that, Sage Restorative will be offering a free consultation. Is that right, Dr. Nyarai? Oh, you're on mute. You can unmute so we can hear you while Dr. Danika is getting situated.
Great. Yes, I'm going to offer a free, since, you know, naturopathic holistic medicine may be new to some folks, so a free consult so that either for yourself as a mom or a dad, or for, you know, one of your children, would be happy to do that.
All right, sounds good. Thank you so much. So I'll remember to give away a consult from Dr. Nyarai. All right,
Okay,
Dr.
I'm just going to leave the meeting for a bit. If we can, sorry, if somebody can start speaking, then I can just try and join the different device.
Okay, yeah, you should be able to share, but you can email it to me and then you can just talk over it.
Okay.
All right. So shall we start with?
Yeah, we can go ahead and start.
All right, great. So Dr. Nyari, over to you.
Good in yourself?
I'm awesome, thank you. So this is an amazing thing that you're doing, you know, natural medicine. And
Yes.
like you're saying, it's new to a lot of people. But I think within an African context, we kind of somewhat been doing it in the background. So
Yes.
now we wanna hear how it's done right. So maybe you can walk us through.
Okay.
What kind of support you give families from the time that they want to fall pregnant, you know, as we go through the different phases of their child's life, essentially. So maybe you can share with us your work.
Okay. Fantastic. Thank you so much, Janet and Shingi. This is so exciting. I'm passionate about holistic medicine and natural medicine. I'm a firm believer in having for the public to have access to all forms of healing, because we all don't heal the same way, you know. So naturopathic medicine is grounded in the philosophy that you are a whole being, body, mind, and spirit. And we're always looking for the least invasive way for treating. There's place for surgery, you know, if you need surgery, there's a place for that. But initially what we are looking at is how can we enhance your body's capacity to heal? And we do that in a multitude of ways. Looking at nutrition, we're looking at lifestyle, you know, where are the imbalances in your stresses? Are you finding joy in your life? Do you feel as if you have a sense of community? Sometimes we separate all these things and we don't realize all of this affects our well-being. So an intake with me is about an hour, and everybody's like, an hour? But I really ask questions about what are you eating? What are your stresses? What is your medical history, your family medical history as well? And then what are the health challenges that you're facing? And then how can we use natural herbs to support you? How can we change your diet? Because food is the first medicine, right? And then how are you managing stress? And what are some ways, some tools that we can impart so that you can use for yourself in your home? I also practice homeopathy, which is another natural healing modality. I love using aromatherapy, which is scents. You know, people, you know, with COVID, lavender became a thing. Eucalyptus, all these things that were probably in the background for a lot of people have become second nature. You know, Zumbani became the herb of the hour, you know, Artemisian and all of that. So really looking at you holistically. So just say if I have somebody come to me and they're having challenges with fertility. And well, we need to understand that issues with fertility have actually increased over the years based on our lifestyle, you know, exogenous hormones because of the use of plastic. So what we need to do to prepare you for conception is to do some detoxing to get your body ready, whether it's the mom or the dad. Really, how do we optimize your health so that you can be fertile? So we look at herbs for that. We look at diet for that. Then, you know, once pregnancy has occurred, and enhancing fertility. So some people have barriers to fertility because they have, you know, hormonal imbalances. They might have PCOS, that's polycystic ovary syndrome. They might, you know, women of color, we have fibroids are pretty high up on some of the challenges women face. Like I mentioned, hormonal issues. And working through all of that so that no matter if you are intending to get pregnant naturally or you do IVF or other forms of conception, we are readying you for parenthood. An exercise that I like to do is for to-be parents to write a letter to their child and to say, what is it that I desire? Why do I desire parenthood? And if this number 1A channel natural pregnancy does not occur, am I okay with plan B? And am I okay with plan C? Maybe I'm adopting, I do IVF. I like to explore all these intense emotional spaces while the stresses of those moments aren't happening, so that you have a clear mind to really think through and talk through with your partner, because it is very emotional. So once you've had a chance to kind of put your thoughts down and figure out, well, how do I feel if I'm unable to conceive? And then what are the options that we are comfortable with as a family, as the couple? And then there's pregnancy and dealing with, nausea, loss of appetite. Are you eating nutritionally rich, dense food for you and your baby or babies, right? Depending on how many you're having. Nausea is a big thing. How are you managing stress? How are you managing with gas and bloating and, musculoskeletal issues? Now you've become front heavy. Are you able to sleep? And how can we help you to sleep in all natural ways? I sometimes might refer an expecting mother to a chiropractor to come and do some adjusting to help them, because maybe they'd be sleeping on the sofa because they can't sleep comfortably on the bed. And so now you're having a strained back and you're wobbling. So, I really believe in a comprehensive, holistic. I think working with other healers and other practitioners in wellness is really important. And I'm really excited that we're in Zimbabwe, we're getting more and more people doing that, participating and referring to each other. So now pregnancy, now the baby's due. How are you preparing for that? There's some teas like raspberry tea, which is very good for strengthening the uterus and also helping with the delivery. And then once the baby's there, there's some teas we can do if you're not producing enough milk and you want to produce more milk. Well, during pregnancy and lactating, there's only a number of herbs that you can take. So it's really important to know which herbs are still safe for you and your baby during pregnancy and also during breastfeeding. So those are conversations we have. People think pregnancy is where all the energy is utilized. It's actually when you're breastfeeding. So making sure the mom is drinking enough water and eating well and resting, because those with a newborn baby, there's very little sleep. So then how can we optimize your sleep? Because when you don't sleep, then you become agitated and the baby becomes agitated. So it just becomes a snowball effect.
That's a lot of information. Yeah. And, probably just spinning back, like circling back to some of the things that you started talking about earlier, being fit is a very important thing. So I know a lot of people, like you're saying, are having more and more infertility issues and things like that. There's one particular question that I would want to ask. What is it with the avocado? Because you hear when people then go and they try to talk to these guys who help them with fertility, they always recommend avocado and raw egg. I don't know, is that a thing? Is it properly done, or are there other ways to do it?
So what are they doing with the avo? I'm not aware of that.
Okay, that's interesting. Apparently they say that avocado increases fertility.
Well, okay, it makes sense, because when you're eating good fats and you're having your omega-3s, and avocados is a very good source of good fats. That's the basis for hormones. So making sure that you have good fats, I can see the link of that. So for some people, they might not be hormonally balanced. So making sure you have the building material for your hormones, having some good healthy fats. So I can see where that is. But yeah, avocado is one of those superfoods, that one should continue having.
Okay. Oh, awesome. Thank you for clearing that up. Then there's another one. I know a lot of women, labor is a fear for everybody. I'm I'm about to give birth, everyone is like totally terrified and they want the easiest labor possible. So people will try different herbs to prepare. In Shona, they say kuvuranzira, to prepare the way for the baby to pass through. And we want people to be able to do that safely and be able to know what are some of the risks involved with the different possible herbs that they use. Some of them, they use elephant dung or something like that. So probably talk to us a little bit about that.
Okay, so one of the things you mentioned earlier about exercise, you know, there's always, we always try to promote that you do some form of exercise where you're walking. Some days, you know, there's yoga for pregnant women. There's some poses that you can do to kind of open your pelvic floor, you know, your pelvic area, because for some women, it tends to be very, very tight. There's some women who also do Pilates. So making sure that you, because it's an exercise, I haven't given birth, but you've had a baby, and if you're doing a natural birth, it's an intense workout. And yeah, so it's just like if you don't exercise and then you run a marathon, obviously that's going to be really intense on your body. So if you're doing some sort of exercises before the pregnancy, during the pregnancy, and afterwards, you know, after you've given yourself some time to heal, that's essential. One of the key herbs that I highly recommend is red raspberry leaf. It has a way of strengthening your uterus, and also kuvuranzira. But all the other Shona herbs, I'm not as familiar with them just yet. I'm beginning to learn about local herbs. The unfortunate thing about studying natural medicine in the US is that you learn more about Native American and other general herbs, and also West African. So indigenous Shona herbs, maybe I might have learned about them, but I don't know the local name. So
yeah, no, definitely.
It's important to make sure you check, because there are some herbs that are increase abortive activity. So, you know, they might be cleaning out your uterus, and you don't want to do that, right? You want to have your baby. So it's always important to just check to see, are these herbs safe for me and my baby?
Oh, yeah, that really definitely is really important, because you hear about them ripening the cervix prematurely, or speeding up the labor process so much that, you know, the baby is not ready to come out and you're not ready, and then you tear and you have a lot of damage after. So actually, in relation to that, let's talk about that postpartum part of recovery. Yes. I personally did not enjoy sitting in salt. Okay, so I would like to know if there's a way of dealing with your C-sections and your sutures, you know, after you've given birth, that is more friendly and easier on the body. Because for me, I mean, I had like pelvic separation, so it was very difficult to squat, if you know what I mean.
Yes. And so what did you end up doing?
I squatted.
What did you do? Okay, you squatted?
Yes. As painful as it was, I had to squat. Yeah. So please tell me that there are better ways to do it.
Well, you know, squatting, you know, I think in olden years, women used to give birth in a squatting position. You know, that's how babies would naturally come out of the birth canal. So maybe I would suggest probably doing some squatting exercises before delivery, during pregnancy, and you know, a little bit afterwards. But I always feel as if you need to kind of give your body a little bit of rest before you start getting into some vigorous exercises. And making sure, if you had sutures, making sure you keep that area clean. If you're unsure about the integrity of the stitching, go back and see your doctor and just check on that and see what's happening. But also postpartum, I think for a lot of women is the stresses, right? You're a new mom, your hormones have now dropped. So there's some emotional upswings, and then you're not sleeping enough. So really be cognizant of what am I feeling? What is this stress? You know, am I feeling stressful because I haven't had enough sleep? You know, can I get some support? Are there people in my community who can help me? Sometimes people live in communities where it's just them and their partner, and they don't have enough resources. I don't know if doulas are pretty common here, but in the US, there's quite a bit of a doula service. It's like your mother-in-law or your mother coming and helping you. And doulas have that training to kind of, like Katinka coming and teaching you how to breastfeed. So if you're living in a place where you don't have local or supportive wisdom, is to find other women who've been down that path and can support you, rather than to alienate yourself and to really struggle with adjusting to breastfeeding. You know, I think yesterday somebody was saying they didn't know how painful breastfeeding was. They wish they had been told it's much harder than it looks. So, you know, creating a sense of community or your own support group of would-be mothers or mothers who can give you some advice on how to do things. Because I'm fully aware that, you know, a lot of Zimbabweans, a lot of people are living in the diaspora, and then you don't have the same network and supportive community that you may have had if you were at home. But doulas are pretty popular. I've had several friends who've had babies. They've worked with a doula or a midwife during the pregnancy and also at the birth, and then afterwards, just to get things going.
Okay, no, in Zimbabwe, actually, well, I was fortunate to have that service. There's a nurse who has an organization called Flow Care System Tizwa.
Okay.
She came and she supported me with both my kids. So she was most helpful, especially for the second birth, because of the separation that I was talking about. And healing took a while. I got to 6 weeks and I was still in a lot of pain and struggling a lot. So thank you for bringing that up. This System Tizwa and her team who are available to do that. Yeah, definitely. And all the other resources that you mentioned. So essentially, as it concerns your practice, what is it that you'd want to tell families out there, you know, about the things that you've noticed, and basically, you know, your one shout out advice to families?
Well, I'm going to go to nutrition, because I think nutrition is key. No matter what else we do, people always say, "Oh, my child doesn't like vegetables." But if you start gradually to introduce and make food interesting, children will learn to eat a diverse array of food. Yes, there's some children who are very picky eaters, but you have to find ways to start to introduce healthy food and not, always have junk food. So if we teach kids from a young age that an apple is delicious, a banana is good, and vegetables are good, and we also make it interesting. Zimbabweans, we tend to eat the same food every day, looking the same way. So if we make our diet interesting, and then children then learn the importance of eating healthy, because that's something that they learn from childhood and they take it on into adulthood. So nutrition is key. I'm passionate about what we eat. I think what COVID has taught us is the importance of gardening. People who never gardened are now gardening. There's so many communities where there's food deserts, and then there's also issues of water. But if you have an opportunity to have a small garden and ensure that your family has some fresh fruits and vegetables often, that's an essential part of health and wholeness.
Oh, awesome. Thank you so much. So I think
I'm going to chime in a little bit and introduce Dr. Tongona. Thank you so much, Dr. Nyarai. So Dr. Tongona was putting baby to sleep. It took a little bit longer. And like we said on Monday, moms and dads are never late, they're just delayed. So we appreciate you being here. Your first order of duty is taking care of your family. So I think Dr. Danica just messaged me that she is ready. So we can move on to her presentation. Give me 1 second so I can share for her. And if you can just let me know when you can see the screen.
Can see it here.
Okay. Let's see. Dr. Danica?
Hello.
Whenever you're ready.
Alrighty. Well, I don't know why the volume is low. Today, technology is just fighting me, but we move. We will not stop.
It's all good.
As long as everybody can hear me, I think that is good enough. Okay, so today I want to talk about oral health care during pregnancy and for infants, all right? I am always asked questions on this. It is a very popular topic question. I don't know how to say it, but people always ask me on this. A very typical case of the common things that actually happen is that a person will come in and they have excruciating pain and they just don't know how to deal with it. And they're probably just about to pop. And usually when it's around that time, we can't really do much, or the person might have a high risk pregnancy. And like in situations like that, the first thing that comes to my mind is, why are you coming now? Why? And I think it's because of one thing. Most people don't actually know that it's very safe for you to come to the dentist during pregnancy. So Shingi can go to the next slide. So the common question is it safe to go to the dentist during pregnancy? And my answer is it is 100% safe. Shingi, can you hear me? All right. So it's 100% safe to go to the dentist during pregnancy. People worry about the X-ray exposure. Do not even worry about that. When we take an X-ray, we know that it is 100% safe. You are just being exposed once, and also it is within the head and neck area. And we always put like a lead apron over you, so no rays will actually go anywhere near your abdomen. So it's absolutely safe. The procedures that we do, they are 100% safe, okay? And if there's any procedure that needs to be done that is invasive, like what I'm saying, I actually had a friend who really suffered and endured through that dental pain because we could not do that extraction because it was a really invasive procedure and she was just about to give birth. So those kind of procedures, we usually schedule them within the second trimester. So the only way for us to do that is if you actually coming regularly. So if you come in during your first trimester, we then probably schedule it and say, okay, this tooth will probably give you problems. Please come during your second trimester and then we just take it out. Or if you come during your first trimester, we just do your cleaning and we do just regular checkup. So it's very important for you to have your checkups during your pregnancy because this actually reduces gingivitis or pregnancy gingivitis. How many people have experienced this? I'm pretty sure a lot of people have experienced this when they are pregnant and they have a lot of swelling in their gums and the gums bleed, and sometimes they can even, like, a gum can really like grow and become so big, right? And it is just the thing. And let me tell you something, it's your hormones. They're just going wild and they're making everything go crazy. So your gums are really just overreacting to just an infection or just dirt that is within your gums. So all you have to do is just come in for your regular cleaning. It's absolutely safe. And also you should know that if you have gingivitis, you actually increase the risk of you having preterm low birth weight babies. So you want to make sure that your gums are super healthy so that you don't end up having any of those complications. Also, during pregnancy with morning sickness, if you do experience morning sickness, when you're vomiting, the acid really weakens your teeth. So it actually increases the risk of tooth decay, because when your tooth actually decays, it is actually acid from the food that you eat, that is eating away the tooth. Now, if you're having morning sickness, you have even more acid, and that can actually increase the risk of tooth decay. By the way, if I can just add another tip, if you are having morning sickness, when you're, let's say you vomit, you must make sure that you wait at least 30 minutes before you brush your teeth, because your teeth are actually weak. And then if you try to brush soon after vomiting, you're actually going to wear away your teeth. So just wait it out and then you brush a bit later. Okay. And then also it's so important for you to come for checkups during pregnancy, because you get to learn more about oral care for the baby. So that's when I'll take the opportunity to say, okay, so your little one is coming. So I just want you to be prepared and to know how you need to take care of your baby's oral health. Okay, next slide, please. So oral care for the baby. Oh my goodness, this baby is so cute, so cute. I just love that picture. I just had to throw it in. So when should you start brushing your baby's teeth? Here's the thing. You actually need to just create a habit of cleaning your baby's teeth. And the only way for you to create this habit is by starting by cleaning the gums, the baby's gums, those toothless gums. Yes, because guess what? Underneath those gums are the teeth, which we want to take care of. So we start there. So all you have to do is to just wipe the baby's gums with a moist cloth, right? And this will help you, the mom, to just get used to the routine, the mom or the dad, to get used to the routine of cleaning the baby's mouth, right? And then it also helps the baby, because the baby gets used to this, like, okay, so we need to clean our mouth after we eat. So just try and stay in the habit of this after every feed. I have a video on this. I'm not sure if we can play it right now, or we just wait to finish the talk. Most likely we'll finish the talk. Okay, so next slide, or the video.
Oh, I can play it. Hold on.
You can play it. Okay, great.
Although your baby's toothless grin is adorable, bacteria can build up on her gums. So it's important to keep them clean even before those first pearly whites pop through. You will need a baby with a toothless grin, a washcloth, and some cool water. Step 1. Soak the washcloth in cool water and wring it out until it's just damp. Step 2. Wrap the damp cloth around your finger. Step 3. Gently run the cloth over the surface of your baby's gums. Make sure to swipe both the upper and lower surfaces. You shouldn't have any trouble squeezing your finger past your baby's lips, but if you do, try tickling her lower lip. This should induce her to open wide. Step 4. Repeat this process a couple times a day, preferably after feedings. Getting your baby used to the sensation can make brushing her teeth easier down the road for both of you. Did you know at birth, a baby has 20 primary teeth just below the surface of her gums?
All right. I'm not sure if people on Facebook were able to see that video. We've had an issue with the videos, but.
Okay. All right. So back to the slides. So you can start off by using like a moist cloth, like well, if you saw the video. If you didn't, you're basically just wiping, you wrap the cloth around your finger, and then you wipe your baby's gums with it, okay? You just use water. You don't have to use toothpaste or anything, it's just water. And then, so you can then graduate to little toothbrushes. So there are these silicone that kind of like you can slip your finger through the silicone brush, and then you just clean those gums as well. Or you can also use it when the first two teeth come out. You know those little cute teeth that come out? Those ones, you need to start cleaning them as soon as they come out as well. And then you just graduate bit by bit until you're now using bristles, and you need to use soft bristles. I've had a friend who was like, oh my goodness, I cannot get my 3-year-old to brush teeth. He's always swallowing the toothpaste. Listen, they're always going to swallow it because they're just thinking, oh, well, this is interesting. Let me eat it. Let me swallow it. And also remember that babies' toothpaste are usually really sweet. They're not very harsh. So of course, a 3-year-old is going to swallow toothpaste. That's why you should just put like a pea-sized amount, and don't worry about that. What we want is for just the fluoride that's in that toothpaste to go over the teeth so that we can protect the teeth. Okay, next slide. So next slide, please.
I just changed it.
You just changed it?
Yes.
Okay, go to the next one. This one is showing the toothbrushes, which I was just talking about. Okay, now another common thing that I come across, messages that I'm always receiving in my DMs. Guys, I just enjoy it. I enjoy answering questions in my DMs and on Instagram and on Facebook, because I just love educating people. Now, the most common thing that I'm asked, what do I do? My baby's teeth, they just came out rotten. And I'm like, that is not possible. And a lot of people actually really think that it's possible, but let me tell you what actually happens. Most times we don't realize that the decay is actually happening, because it usually starts off as just a white patch, and then it becomes a small brown patch, and then all of a sudden, bam, you've got a big, big brown patch, because that's just how the teeth decay. And what causes tooth decay is diet, what the baby is eating, and mostly what the baby is drinking. So what's shown in the image is what we call baby bottle caries, which is a very common thing that happens, and it's caused by letting your baby sleep whilst they're drinking milk from the bottle. So the milk actually has sugars, and if you leave that milk on the teeth and it's not wiped off or cleaned off, then the decay happens. So this is what happens. Next slide, please. So how do we actually prevent this baby bottle caries? Okay, you basically just have to clean your baby's teeth after every feed. Avoid leaving the baby to sleep with a bottle in the mouth. And please don't substitute milk with juice, because juice has sugars. And don't use maheu either. Maheu is a common culprit. I can tell you this, because we say it's nutritious. It's got like it's like a traditional drink, you know, and you know how we feel about our traditional drinks and traditional food. But we do have to remember that maheu also has sugar, and these sugars also cause tooth decay a lot of times. And also remember that milk also has sugar. If you they start giving baby ordinary milk, milk still has sugars. So the key thing is to make sure that you clean the baby's mouth before they go to bed, and just avoid giving them the bottle for them to go to sleep with. Next slide, please. And then lastly, I just want to talk about bad oral habits for children. One very common one is thumb sucking. This is a common one. This is a very common one. And I know a lot of parents struggle with this one. So what happens is if a baby keeps on sucking their thumb, after the milk teeth have fallen out, right? This can actually cause what we call an open bite, which you can see in these images, where the front teeth don't actually touch each other anymore. So I wonder, next slide please, how do you think we can deal with this? There's a very common tradition here in Zim, which is to put bilebile on the baby's thumb, just to make sure that they remember not to suck their thumb. I mean, I find it so horrible. It's so painful. I mean, just look at that baby. So we don't actually have to do this. There are other nicer ways. So let me start with the home remedies that you can do. You can try and make the baby wear mittens or socks on their hands to try and avoid them, stop them from sucking their thumb, or just find something to just cover their hands so that they can stop. This can actually work to stop the habit. Next slide. So those are just home remedies, nicer home remedies. Just keep the hands away from the mouth. And then we've got the remedies that we can provide for you at the dental office, which are called habit correctors. So on this slide, we have an example of a habit corrector. So you see that white rolling pin that is attached to this metallic thing. So it's going to be a reminder for someone. So it's really ideal for patients who now understand. So it's usually for your older kids around maybe age 5, 6, 7. As long as your child understands that they need to quit sucking their thumb, then we can put that habit corrector, and it's going to help them. It's going to help them remember every time when they put their thumbs, it's just going to roll out of the mouth, and then they'll remember that, oh yeah, I want to quit sucking my thumb. Next slide. We also have other habit correctors. Some may be very uncomfortable, and we use those uncomfortable ones for those people who are not cooperative at stopping, and then you really want them to stop and you make it really uncomfortable. Then there's also a habit of lip biting, the lower lip. There are some children who bite their lower lip a lot. I've come across that. And there are also habit correctors for this to also help. And then this is our last slide. Whew, curious question, right? To use a pacifier or not? Okay, I am going to say this. The pacifier, it's okay to use it. It's helpful, right? But there's a certain period where you now need to stop using the pacifier. So the usual recommendation, even with the American Dental Association as well, is you shouldn't use it past 18 months, right? That's what, 1.5 years. From then on, you need to stop. By the time that child is 2 or 3, you need to stop using that pacifier. Otherwise, we will have an open bite, just like with thumb sucking. I saw someone had asked that question. Are dummies safe to use? They are safe to use up until a certain age. Past that age, you need to stop so that your baby doesn't develop this. Remember, it's all about the permanent teeth or the adult teeth. The milk teeth, they'll fall out. But once the milk teeth have fallen out and now you have the permanent teeth, you want to stop immediately. So yeah, it's better to stop sooner than to stop later. And that's it. I hope I was within the time frame that I've been given.
You did great. You did great. Thank you, Dr. TUDiki. Could I ask a question quickly from that last image that you put with the open bite? Does it actually affect the structure of the gums, like the pacifier and the thumbs of the gums? Because it looked like the gums were now this shape.
It affects the shape of the bones. So this action of pushing, because they'll be really like using the thumb as a suction. So when they're doing that, they're pushing their maxilla, which is the upper jaw, they're pushing it forwards like that. And then it ends up being pointy. They push it upwards and forward. Then they end up having a V-shaped upper jaw instead of having a nice U-shaped upper jaw. So that's the shape that's actually changed, not just the gums. So it's the whole bone. Wow. So to correct that, it can be corrected. So to correct that, we just put braces and then we correct it. But prevention is always way cheaper, way cheaper.
Yeah.
All
Thank you.
Yeah.
I have
I think you've got questions, right?
Yes, I have a few questions and I have a prize to give. Thank you so much, Dr. Za. And you saw her contact information on there. Dr. Zanele is with Timeless Dental Clinic at Westgate, so you can make an appointment with her. The information is on our website, TheTudikishower.com. Her phone number is 0778-090-243. And you can also email her at za.dinika, DINIKA @gmail.com. Her Facebook is Dr. Zanele Dinika. And you can Instagram her, like you said, she can answer your questions, you know, to a certain extent. You know, you also have to pay her, so you need to go in. So you can ask, you can retrieve it on Instagram. So her Instagram handle is at Dr.Zani Dinika, ZANIEDINIKI. I'm going to ask a question from someone on here. Said, is using a dummy on the baby safe? I've heard Bakuru say Nova. How true is it?
No, it's got nothing to do with Nova at all. Okay. The only thing that I spoke about dummies is the open bite, and it's all about timing. You just need to stop at the right time. It just affects your teeth.
Okay, perfect. And I don't know who I'm gonna give the prize to. So I'm gonna show you, we actually have these toothbrushes that Dr. Dinika was showing us. So again, you can go on our website, and by now you should know our website, www.TUDiki.com. And we have this 4-stage, I'm not sure if you can see it just yet on my screen. We have the 4-stage oral care set that has the different stages. So you have stage 1, stage 2, stage 3, and stage 4. So I'm trying to see who I can give that prize to, or if I cannot find anyone, I'll give it to Dr. Za, so she can give it to a patient who attended the Tudiki shower. So if you make an appointment, I'll give away 2, one for here, and I'll give you one, Dr. Za. So you can also give someone. I'm not seeing any questions on Facebook. I wish I could give it to you, Delita, but you're not in Zimbabwe. I wish I could give it to you. So let me see. Nyarai Sarah on Facebook. She's also a doctor. So Dr. Nyarai, you can pick that up at our store. You're the winner of us. I'm not sure if you have any little ones, but you can certainly.
I'm excited. I actually have a niece who's expecting, so I'll pass it on to her.
Oh, that's you on Facebook. I didn't know that was you, Dr. All right, so you are our winner. See, she's a panelist and she won. So this wasn't rigged, guys. I actually didn't know her on Facebook. I just picked a winner. So yeah, that's our first prize winner. So you can definitely stop by at TUDiki, or you can order it on our website. And I'm gonna stop sharing. And Janet, we have Dr. Tongo Ona, who's going to be discussing, she's a new mom, and she's just going to be sharing some of the things that she's experienced from a mom's perspective and also from her medical point of view. All right, Dr. Anisu Tongoana.
Hello, everyone. Thanks for having me and taking the time to listen. So I'll just give a quick intro about myself, just so that the talk can make sense. So basically, I'm a doctor and I qualified about 9 years ago. I qualified in South Africa and I worked in South Africa for about 6 years, and then I did a master's in public health, and then that's when I transitioned to public health work. So I worked in HIV vaccination research after my degree. And then along came baby, and my husband and I decided, we made the decision that one of us, which was me, would be the full-time parent, because we both have demanding jobs, and At this point in time right now, it just makes sense to have someone being full-time parent and the other being fully employed. I just wanted to touch on HIV, the way I saw it in South Africa, and just to give a few general points for moms, new moms, and even though it might not affect you personally, but I think we all know somebody who's affected by HIV, or and any information is always valuable. So in terms of HIV, it still affects a whole lot of people. With PMTCT, we have seen a huge reduction in HIV infection in newborns. So that's a big plus. But it is still very important to be tested, especially when you're pregnant, and to test every 3 months. The advice we give is, if you're negative, you continue being negative, continue protecting yourself. And if you're positive, now the WHO recommendation is, once you test positive, you start treatment immediately. And this is when you're pregnant. And after you start the treatment, there's always the blood testing and the counseling that comes thereafter. And the aim is to decrease your viral load to undetectable, so that it's not possible to pass on the virus to the baby. So once baby is born, we do a test called the PCR test, it's called the polymerase chain reaction test. So basically, it's actually looking for the virus itself in the baby. Basically, you can't do the normal antibody rapid test on a baby because, firstly, if you're breastfeeding, the antibodies from the mother will pass to the baby. So that test will always come positive. That's why we have to do a PCR test to check for the virus itself. And then if this is negative, the baby gets prophylactic treatment. And this is if the mom is positive as well. We encourage to breastfeed because in our setting, well, I'm talking in the setting of Zimbabwe, South Africa, where it's a low-income country, low-middle-income country. We don't really encourage formula feeding because for a lot of people it's too expensive, and then that might bring out instances where there is mixed feeding. So if a mom decides that she wants to formula feed, you do have to go through a few criteria with them. So WHO does actually list the criteria. So we call them the AFAS criteria. So is it acceptable, as in socially acceptable? Will she have support? Is it feasible? Can she actually carry it through, feeding multiple times a day? Is it affordable? Can she afford to buy formula, here and then, and actually dilute it to the right amount? Is it sustainable? And is it safe? Does the mom has safe drinking water? Is it clean? Is she cleaning the bottles and equipment and sterilizing properly? So that's, sorry, I'm speaking really fast because I've got quite a number of things to get through. But if you have any questions, feel free to just ask. So that's just the touching on around HIV in the mom and the baby. So one thing, a lot of things that I saw when I still consulted as a general practitioner in South Africa. So a lot of things that moms go through with children that they're not actually sure what to do. And to be honest, me as a new mom and a doctor, like being a mom is kind of, you're just shooting in the dark half the time. You're just like, are we alive at the end of the day? I can admit that being a doctor has helped me to get through some times when Malia's not feeling very well. Malia is my daughter, by the way. Just knowing what I can do and do I need to take her to the emergency room? Can I stay and just watch her? So I'll just go through a few things. So the first thing I'll go through is nasal congestion. So this affects a lot of babies. And actually the first couple of weeks, you might notice that baby is quite congested. And usually this happens because of the estrogen in the system. The tissues are swollen. So you can see if you've just given birth, you have that ripe look, you're quite, swollen, tissues are congested. So this can also happen in the baby. And sometimes moms don't know how to handle this. So when I was in the consulting room, I'd get a lot of moms coming in, like, how do I manage this nasal congestion? Do I use nose drops? What do I do? So the thing is, babies are obligate nasal breathers. They breathe through their nose, and they cannot blow their noses like us adults. So we just need to help them to clear up the nasal passages so that they can breathe properly. So what I used to suggest to moms was saline drops are your friend. Saline drops help because if there's mucus, they help to thin that mucus so that it can run out quite nicely. Oopsie, I'm sorry. Sorry about that. Secondly, so there's also a nasal aspirator that you can use. So common ones are the bulb aspirators that get the mucus out. There's also one of the favorites that I used to recommend to moms is the Nose Frida. I can send a link later with that one. That one is very helpful because you actually suck the snot out for a baby. So this usually helps as well. And also having a humidifier just to keep that air moist and to keep the nasal passages free of any mucus. So that's what I used to suggest to moms. And if this progresses onto a cough, so coughs are mostly of viral origin. And one thing that a lot of parents used to ask for was antibiotics. So you just have to go through the explanation, like most of the coughs are viral in origin. So usually they self-resolve. And the tips that I just gave with the nasal congestion, they also help with coughs because if the cough is due to what we call a post-nasal drip, meaning some of the mucus is running down at the back of the throat, irritating the throat, causing a cough, then that starts irritation will cause like a chronic type cough. So the things to watch about when baby is coughing too much are your what we call the danger signs. So that's fast breathing. If your baby looks really uncomfortable breathing, then you know, okay, this needs to be looked at. And also grunting. So when they're actually making an effort in breathing, then you know that it's probably not just an upper respiratory tract infection. It's probably gone down to infect the lungs. So you need to go in and get seen. We do not advise to give cough syrups, especially in babies and young children. Most of the coughs usually resolve by themselves. Secondly, I want to talk about constipation. So constipation, a lot of people come saying, okay, baby hasn't pooped in 1 or 2 days, should I be worried? Normally, so for breastfed babies, they can go up to a week without pooping. If the stool is not hard or like pebbles, pellets, and your baby is not straining whilst passing stool, then it's not constipation. So usually if baby is breastfed, we just say continue breastfeeding, the poop will come. And also same with formula feed, continue the formula feeds. If there is constipation with a formula fed baby, you might consider changing to a different brand of formula. Yeah, normally just continue your feeds, the poop will come. And if baby is more than 6 months and is on solids, one thing that a few things that help, a bit of prune juice, a bit of apple juice, and sometimes peas can actually get the bowels moving. So just to relieve that constipation. And I never used to advise using laxatives. So yeah, so that's it about constipation. If you have any questions, feel free to ask me. And then a third thing, I have 3 more things to talk about. So colic, the mystery colic that a lot of people go through. A lot of people don't really know what causes it. Sometimes it's blamed on gas, an upset stomach, reflux, but basically it's just prolonged unexplained crying. And it usually happens in males more than female babies. Usually it clears up after about 4 months. So for a lot of parents, this can be very frustrating because from the parental standpoint, you know, you've done a lot, but nothing seems to be helping. And from a medical standpoint, baby seems quite normal, nothing's wrong, but there's just this unexplained crying. So from a mother's perspective, I would advise swaddling, wearing your baby. That comfort just helps in calming down the baby. I know we talked about pacifiers just now with Dr. Danica. Sometimes that helps. And if you're breastfeeding, the breast milk provides comfort, and just that soothing sucking action helps. And then if it gets to a point where it does need to be investigated, then we'd have to consult with the pediatrician and investigate for reflux that can be helped, or even food insensitivities. Yeah, so that's about it about colic. And then the next thing is fever. So normally when your child's temperature is more than 37.5 degrees, or for those in the US, more than 100.4 degrees Fahrenheit. So under 3 months old, I would suggest if your baby has a fever, just consult with the doctor, because babies cannot tell you what's wrong. You would need a top to toe examination, checking the ears, checking the lungs, just checking the urine as well to see if there's any source of fever. Over 3 months is what I would suggest is watch your baby and not the number on the thermometer. So fever is basically your body setting a higher temperature point so that it fights off any bacteria, virus, or parasite that's in the body. A lot of the time it resolves by itself. If your baby is active and still going on their normal activities without any interruption, you know, if they're going to school, you know, I'd suggest keeping them from school until the fever resolves. But normally over 3 months, I would watch baby instead of the number on the reading, number on the thermometer, sorry. And then if the fever hasn't cleared up in 48 to 72 hours, then you can consult with the doctor. But also with the baby with the fever, you want to help to bring it down. So you start with simple things first. Take off any clothing that might trap heat. Cool clothing, you can try a tepid bath as well. And then as a last resort, you can give paracetamol. And I would suggest instead of giving it with a spoon as in eyeballing a measurement, just have a syringe with you at home so that you can give exact measurements. Because in babies, you don't want to overdose any medication. And then the last thing I want to talk about is diarrhea. So diarrhea is basically frequent watery stools, and in babies you're just changing diapers a lot more frequently than usual. They say more than 5 watery stools in one day, but also as a parent you know your baby best, and if it's a lot more than you normally see, then then you would consider it as watery stools. So babies get dehydrated quite quickly, so it's important to replace those fluids early on. And if your baby is less than 6 months and breastfed, breastfeed, breastfeed, breastfeed as often as possible. On formula, keep up those fluids, keep giving formula milk, and make sure you sterilize properly and that your water isn't contaminated. If your baby is on solids, also still keep giving those fluids. And an important one is the oral rehydration solution. And I know for some, it might be, you might not imminently have it at hand. You can always make the rehydration solution at home. So that's in a liter of water, you put 6 level teaspoons of sugar, half a teaspoon of salt, and of course the water is boiled and clean, and then you give your baby to sip during the day as much as possible. And then you just watch out for signs of dehydration in your baby. That's if they're a lot more lethargic than usual, if their eyes appear sunken, the mouth is drier than normal. Like, you know, when you look at the mouth and the mucosa in the mouth is nice and moist, if it looks dry in a baby, that's usually a sign of them being behind on fluids. Once you see those signs, then you would want to take them into the doctor or increase the fluids. But one last thing I just wanted to say is, as a parent, you know your child best. So even if you think it's something minor and you're not comfortable staying at home with your baby, then rather take them in to be looked at by a professional. You won't lose anything by having them looked at, just being over careful. Yeah, so that's it.
Wow, thank you so much, Dr. Tongona. That was a whole lot of great tips that you just shared there. And I think a lot of moms will be, it allays the fears because we've gone through it when they were younger, and also for those who have little ones, they've got something to reference. I have a few questions, and I know Shingi's probably got something as well to ask in relation to what you just talked about. So there is the issue of give the child water. You talked about hydration just now. So the child will be breastfed, or they'll be drinking milk, or even watering down whatever it is, the milk or the water. Please, can you tell us a little bit more? I've heard about water intoxication, like too much water can be a bad thing. Can you please probably give us some clarity on that one?
Okay, so I'm just going to repeat the question so that I'm sure I understand what you're asking. Okay. So you're asking about giving water to a baby more than 6 months or less than 6 months, infant, or more than 6 months?
Probably we can talk about the little ones, because you also get the little ones being the infants. Mm-hmm. Family giving pressure, give that child water, and they're already breastfeeding and things like that. Also, I think it'll tie in with the HIV conversation.
Okay. Okay, so in breastfed babies, WHO recommends exclusive breastfeeding for 6 months, meaning just breast milk, nothing else. If your baby has diarrhea, so what I advised to my patients was just continue breastfeeding. You may breastfeed 10 times a day, or increase the breastfeed frequency, basically. We do not encourage mixed feeding or mixed fluids, particularly in HIV, in babies who are exposed to HIV or potentially exposed to HIV. We don't encourage any mixed feeding in the first 6 months. So with that, I know there's a lot of pressure to give the baby water or give them something else, you know, with a little bit salt and sugar and everything. But I would advise just to increase the breastfeeding frequency. And if they're not comfortable in giving the baby water, then rather, and if, you know, they feel that the breast milk is not enough, rather get seen by a professional who will either, you know, give baby fluids in the hospital or, you know, give them, you know, another type of fluid that they can give at home. I wouldn't advise giving water, just water.
Thank you so much for that. Then speaking of the same subject, there's the issue of NOVA.
Mm-hmm.
You know, and there's so many, you know, the fontanel, there's so many solutions, the homebred solutions that have been talked about over the years. Can you probably give us clarity on what it is when the fontanel is sunken and what parents should do in the process?
Okay, so basically the fontanel. So when your baby is born, right, the bones in the skull, they're not fused yet. So in the front, there are actually two fontanels. There's one in the front, like right here, that's where you see it, and one in the back. That one is a lot smaller. So the one in the front, by about 18 months, it closes, as in the bones are much closer together. So you don't actually see it. So when we talk about NOAA, correct me if I'm right. So NOAA, you're talking about the fontanel, right?
Yes.
So if it looks sunken, that means your baby is dehydrated.
Okay.
Yeah, so that is one of the signs that we look at actually. When a baby comes in with diarrhea, when we're checking for signs of dehydration, we look at the fontanel, actually feel it, and if it's sunken, as in you can actually feel it going like a dip, then you know it's your baby is dehydrated. And if it's bulging, then that's another ball game. Then you're worried about meningitis or increased pressure in the head. Yeah. So.
So for that, you just like what you were saying.
I'm sorry.
Like if it's sunken, we're just breastfeeding to rehydrate the baby.
No. If you see that the fontanel is sunken, that's actually a later sign of dehydration. So that means actually take your baby to the hospital rather. Oh. Yes. Yeah. So there are I don't want to sow panic in people. But you know, there are levels, yes. So you know your child. If it looks like there's a slight dip every single day and your child is fine, then you know you're not gonna take your child to the hospital straight away saying, oh, my child is dehydrated. Meanwhile, your child is running around. But if your child has been sick and has been passing lots of watery stool, and then you see the fontanel looks quite sunken, or if your baby has hair and you actually feel it, and that it's dipping a lot more than usual, then your baby is behind in fluids. Yeah.
Okay. Yes. Thank you so much. Shingi, do you have anything you want to ask?
Yes. So Edith Utete is asking, is it safe to give baby Telemint drops for colic?
So that's Telemint is gripe water.
Water.
Same stuff.
So there are lots of debate on gripe water, and a lot of medical studies have been written about gripe water and the risks and the benefits. I think, to be honest, I've used it before. And the important thing with gripe water is to check your the ingredients, because some of the gripe water that is sold actually has alcohol as a preservative, and I wouldn't advise giving that to babies, because alcohol is a depressant, and you know, maybe that's why it was popular in the long run. Maybe that's why it was popular a long time ago, because it made your baby sleep. But I wouldn't advise giving anything with alcohol as a preservative to your baby. Some of the newer gripe waters that are being made only have natural ingredients in them. So for instance, ginger, and a few other remedies that help just to soothe gas, and to soothe that GI system. Those, a few drops here and there, I wouldn't mind. But to be honest, I don't know the exact ingredients of Telemit since I've never used it before. In South Africa, we didn't have the same brand. But I would advise just to look at the ingredients, because some of it has alcohol as preservative, and I wouldn't advise giving that.
All right. Let me see if I have another question. This is actually, thank you, Dr. Tongona. That was really, really good on just caring for your baby. So Dr. Nyarai talked about pre-pregnancy journey and what you do, while you're pregnant, just to stay healthy and well-nourished. Dr. Danica went into dental health. I have a few questions here for Dr. Danica before I ask for some closing remarks from our doctors. Dr. Danica, it seems you have a few questions. The first one is, my baby has been accumulating a thick layer of milk on her tongue. How do I clean it? Every time I try using my fingers, it's just so difficult. She's 13 weeks.
Okay, so for a 13-week baby, yeah, I can imagine that it's not easy. There was like a little tongue scraper that I actually saw when I was Googling some images. I'm not sure. I don't think is it part of your pack? The one that you have?
Yeah, let me share, and I can. We do have it. You can go on while the screen pulls up.
Okay.
I can pull it.
All right. So you can use like a little tiny tongue scraper that will really, really, really help with removing the milk from the tongue. But like I said also in the video, just using a wet cloth can also help to remove the milk. You just put water on it, nothing else, and that will really help. Yeah. But I think for the tongue, a tongue scraper is the best thing. Even adults use tongue scrapers, and they're really good.
Okay, so this is it. It wasn't opening when I tried to open it. So that's the tongue scraper. We have one, it's $6, silicone finger oral massager and toothbrush. It's a 2-pack. It has 2 sides to it, so you can massage your baby's tongue with it on both ends. And the other question for you, Dr. Danica, is, are teething gels safe? And this is Shandi Muyambo on Facebook.
Teething gels. Well, I think they're generally safe. I haven't really gone into the ingredients that are there, but I think the most important thing, just like what Doc was just saying, the most important thing is to read the ingredients of whatever it is that you're using on your baby. So if there's a red flag on the ingredients, don't use it. But teething gels are generally safe. They usually just help to soothe the baby's gums whilst they're teething, because it can be quite uncomfortable. Teething toys also help, because really they're just looking for something to chew on and to just ease the sensation. So someone also asked on that question about the white layer, that could it indicate thrush? Not always. Thrush is usually very, very painful, right? And the baby would be crying and probably struggling with feeding. A white layer in babies is most likely just a milk layer, unless your baby is crying and they have pain or they are struggling to feed. Or if when you wipe off that white layer, then there's bleeding that happens after wiping off that white layer, then that would mean it's thrush. But it is highly unlikely for a baby to have the thrush, because thrush usually happens in immunocompromised patients or people. So you're looking at your diabetic patients, some patients who might have been infected by HIV, they might be immunocompromised, and then they start having the yeast infection, which is thrush. But that doesn't usually happen in children. But if your child is showing signs of pain or there's bleeding when you scrape off that white layer, then maybe it could be thrush, and then you take your baby to the doctor.
Okay, I'm gonna do a giveaway. I'm gonna give this prize to Delita because she's remote and she's been chatting a lot with Dr. Nyarai. So Dr. Nyarai offered a free session for her Natch, and I know Delita is into that. So this one, I have to admit, this one's rigged. Because I know who Delita is, and she's been going back and forth with Dr. Nyarai. So I'm going to give you that free consult from Sage Restorative. And Dr. Nyarai is in Zimbabwe. She's in Newlands on York Avenue. And you can give her a call. Her information is also on our website. So you can get in touch with her directly and continue the conversation. Let me see if we have, before we go into closing remarks, I just want to make sure that we've answered all the questions. The Nova question is always a big one, especially in Zimbabwean culture. Let me see if there's anything else so we make sure, because we're just wrapping up right now. Yeah, it doesn't look like we have a lot of questions. So that means you have been thorough in answering the questions. One person had asked Dr. Danica, can you show me how to clean the baby's mouth? And she had a video for that. So we really appreciate you and demonstrating it. So if you have any questions, like I said, Dr. Danica is at Westgate at Timeless Dental Clinic. You can inbox her, DM her on her Instagram or on her Facebook. Just look for Dr. Zani Danica, or call her or send her a WhatsApp message 0778 090 243. And Dr. Nyarai from Sage Restorative, her website is sagehw.com, sagehw.com. She's in Newlands. Her email address is info@sagehw.com. You can make an appointment worldwide, so you don't have to be, I see a lot of people are calling in from different parts of the world. You don't have to be in Zimbabwe. She's taking appointments remotely, so you can definitely get in touch with her. Janet, I'd like to thank you so much. And like I said, Janet has become somewhat of an expert. She's putting together information which really is lacking in Zimbabwe on just a centralized resource on just where you can read information about parenting in Zimbabwe. So she's done a pretty good job with her blog, Mwanangu Mtanami, and you can go on our website again, TUDikishawa.com, to see that information, and you can check out her social media pages. And before the doctors give their closing remarks tomorrow, we have Dr. Nyarai again on wellness, and one of the issues that came up was postpartum depression or postpartum anxiety. So she's going to be addressing that tomorrow. And if you don't know what that is, please tune in tomorrow. We have wellness and health and beauty. Moms like to always look beautiful. So we have that tomorrow. And on Friday, I keep saying this, I keep just creating some excitement for Friday. Friday, we have fatherhood, and the fathers are just going to be sharing on just their parenting journey as fathers in Zimbabwe, what's lacking, or where are they falling short, or where are they actually doing their job really well. And I know Mr. Sarur was on the line. We're very excited for Friday. So I'm going to throw it back to the doctors. Just any closing remarks, brief closing remarks, any advice, parting words to our parents.
Well, for me, I've just realized there's one thing that I forgot to mention. When are you supposed to bring your child to the dentist? This is as soon as they turn 1 year old. So what we actually say is that's like 6 months after the first tooth has come out. we just want the child to be used to the dentist. I want to be friends with you. I want to be part of your family. That's the whole idea. Your child should just grow up knowing the dentist's name, used to the environment. They shouldn't be afraid of coming into the dentist. That is one of the biggest challenges that we have. Children really are just anxious because they're afraid. And please don't use the dentist as a punishment. Like, okay, tamskanza, takuendesa kwa dentist. And all of that. No, we should be friends with the babies, with the children, and yeah, just be part of the family.
Dr. Poweni?
Oh, you're so right, Dr. Zanele. I think, the dentist is so feared by so many. So thanks for sharing that. Thank you for this beautiful opportunity to share. Parenthood is a journey, and one cannot do it alone. I think that what this baby shower has shown is that there are lots of resources out there. I think it's just important to reach out and find somebody, or Google, or find a place where you can find the resources to assist you. From a natural health perspective, wellness is not just physical health, it's also your mental health. And the parents' health also affects the children in their household. So when parents take good care of their health and they have open communication and eat well and play together and experience joy in whatever capacity that is, that helps your immune system, that helps health overall. So there are many things that we can use, home remedies. It's always good to check your source. Dr. Google is not always the most accurate. It is helpful, but natural remedies are out there. Nature is abundant in its resources, and sometimes we're able to address the minor issues, but don't wait too long to go to the doctor and seek medical care, and get your children and your family used to going to the doctor and getting your checkup. Prevention, as I think all the doctors have said, prevention is much easier to address than dealing with a health crisis afterwards. But stay well, be happy, and enjoy the rest of the year. It's gone by so fast, hasn't it?
It has. And Dr. Anisu, and then Janet, who's been really awesome at moderating, will give us the closing remarks. So Dr. Anisu, any parting words?
Yeah, I think I would echo what Dr. Danica and Dr. Nyarai said. Like, you just have to take care of yourself. Parenting is hard. For me personally, it's the hardest thing I've ever done. From medical school to master's degree, I think this is the most challenging and yet the most fulfilling. I think one of the best pieces of advice that I got was from my oldest sister, who said, just set up a routine from the beginning and keep with that routine. So, so just to create a bit of predictability for your child. And, like when your child is approaching those terrible twos, as they say, at least, when you have a routine, some of the meltdowns might be mitigated because they know what's coming next, that nothing is sprung to them by surprise. And just also like talk to your partner, because this having a child is like the biggest test of a marriage. So just find out what both your expectations are, what your philosophies are on raising a child, how you see what you think a family is, and how you plan on raising a child, because you may find that you have different views and different methods, particularly disciplining or education, language, So I think also one of the most important is to be a team with your partner and always communicate your needs and your expectations.
Great, yeah.
Yeah.
Thank you so much, Dr. Tongona. That closing remark was like amazing. And for me, I think I want to thank you all, to our dear panelists. You've been so helpful, so informative, and we're thankful because we don't get this information off the bat, you know, and so thank you so much for taking the time to come out. What I learned from here was you need to be structured, you need to
I think Janet is losing power. She had told me earlier.
Oh, you can you hear me now?
Yes.
Okay, awesome. So I was saying, thank you so much for everything. It's such a wonderful show you gave today. And so creative, and I learned. I hope I'm still there. Am I?
Yes.
Am I still there?
Yes.
Okay, because I could see you all have frozen. Consistency, knowing those also be what you're doing with kids, like reading the labels, reading the signs, knowing exactly what you're giving your children. So thank you so much. I know Dr. Nyarai wants to share later on some herbs for postpartum support and things like that, and even home.
All right, I think Janet's connection is messing up her closing remarks, but thank you so much. And you can still watch this on replay on Facebook. We're posting it on Janet's Facebook or YouTube channel, Mwanangu Mtanani. It's also going to be on the TUDiki YouTube channel, TUDiki on Instagram and on YouTube. Thank you all. God bless. And please stay tuned for tomorrow and Friday. Have a good day and have a great evening, everyone.
Thank you, everyone.
Okay, thank you.
Thanks. Good night.
Right.